Welcome to Health Connections on KCAT TV, Los Gatos, Montserrat. You know, it's every doctor's job to help you stay healthy throughout your life. And most doctors would say the best way to stay healthy all of your life is to exercise. Whether you're 3 or 13, 33 or 73, it's important to stay active. Exercise at least 5 days per week. Obviously, we all think that exercise is important, but sometimes it can lead to injuries. So today on Health Connections, we're going to talk a little bit about preparing to exercise healthily, some common sports injuries, and how we take care of them here at the Palo Alto Medical Foundation. Join me in welcoming Dr. Simone Wang, one of our wonderful family doctors here at the Los Gatos Center. It's nice to see you, Simone.
Nice to see you.
Thanks for joining me. So let's talk a little bit about prevention. What are some of the best things that our patients and families can do to help make sure they're healthy enough to exercise and prevent injuries?
So some of the best things that we can do to prevent injury are making sure we're prepared for the exercise that we're going to do. 3 good ways to do that are making sure that we're stretching before and after exercise, making sure that we're properly hydrating for the exercise that we're going to do. So if we're having more heat, we're going to want to also replenish with electrolytes and make sure that we're having low sugar, but sports drinks like Gatorade or something like that to replenish our losses. And lastly, we always want to look at conditioning, whether you're a weekend warrior or whether you're an athlete in a varsity team. Conditioning is important for both of these to prevent physical injury.
Thank you. Let's talk a little bit about different kinds of sports and how we might make sure we're in good shape to do them, as well as prevent for safety. What actually happens to our muscles when we stretch them? What's going on inside? And what's the best way to stretch?
So when we're stretching, we're basically preparing our body for any sort of exercise. And we talk about warming up, and that's a little bit what's happening on the inside of the body. The muscles are actually stretching, they're becoming looser. We're preparing them, we're telling them, hey, we're going to be using you, there's something that we need you to do, and then they're more prepared to do that. A lot of injury comes from when a muscle is not prepared to do what we're asking of it, and then we can see tearing and that sort of sprain or strain type of injury. So when we're warming up and we're doing our stretches, there's no perfect magical formula to how much is enough. A lot of it depends on the athlete. Certainly a ballet dancer or a gymnast is going to warm up and stretch a little bit differently than maybe a soccer player or a football player would. What's important is if you're doing what we call isometric stretches, basically you're not using any weights or doing anything, you're just kind of static doing your stretches. You want to hold them for about 30 seconds and do about 1.5 minutes of stretching. Certainly tailored to your sport, this is going to be different. So this is more for our avid runner or someone who's working out at home before you get on the treadmill. That would be a good recipe so that you're actually checking in with your muscles and they're prepared for the activity they're about to do.
Why do we need to stretch each muscle more than once if we're just preparing for the same activity?
So we have to stretch more than once because one time might not be enough for that muscle group specifically. So when we're checking in with that muscle and we're stretching once, it still might not be ready for what we're doing. And like I said, there's no magic recipe, but there certainly is a little bit of a minimum. So if you're just stretching everything once, it's not really doing as much as if you were doing your muscles a couple times and then you've checked in, all systems are go, you're able to do the exercise you need.
In your family medical practice and in mine, we see children and we see adults, basically children of all ages. One common sports activity that I see my kids doing especially are things like skateboarding, rollerblading. How can we as parents, and also how should our kids, make sure that they protect themselves and be safe during those activities?
So for common sports like that, and I definitely see that as well, skateboarding, scooters as well, helmets are our number 1 priority to prevent injury for both adults and children. I think we definitely stress it a lot more for children, but we can't forget that this is just good health care for adults as well. Other types of injury prevention would be, making sure, depending on what you're doing, elbow pads or knee pads, that sort of thing. And then once we have the proper equipment and we make sure our equipment is in gear, we want to make sure we also know things like the rules of the road. making sure certain high traffic areas, and then also depending on the age of the child, making sure if a parent needs to be present during those times as well.
And if I can add, like to make sure that if we're exercising outdoors in the evening, that as Dr. Wang said, we're following the rules of the road and that we're visible. Low light, early evening is a very common time for accidents and injuries to occur, sometimes very serious ones. So please be sure to wear reflective clothing and be very safe and aware of your surroundings. With that, saying that we're now all prepared and well conditioned for exercise, we've stretched, we've got our helmets on, our knee pads, what kinds of troubles should we watch out for when there are accidents? What happens most commonly to people who are skateboarding or kids who are rollerblading?
So we see a lot of bumps and bruises, cuts and scrapes, that sort of thing. So a lot of these, when they're lower level, can be taken care of at home. They don't necessarily have to come in to see the physician. But if there's something that's a little bit higher level, something that needs stitches or something that's more concerning like a broken bone, these would be reasons to come in and see your physician.
What kinds of things can we do at home before we have to go in to see the doctor?
Yeah, so for low-level scrapes or bumps and bruises, that sort of thing, the most important thing to make sure is that we clean out a wound very, very well. We worry about risk for secondary infection, so we want to make sure, especially for asphalt and that sort of thing with skateboards, we're able to get all of that material out. A lot of the things can be purchased over the counter, like a triple antibiotic cream, Band-Aids, that sort of thing, keeping things clean and dry after they're there. And then otherwise for bumps and bruises, contusions, that sort of thing, ice is always a underutilized remedy. It works so well. We want to make sure that we're never applying ice directly to the skin, wrapped in a nice towel, and our timeline is 20 minutes on, 20 minutes off, and you can repeat that up to 3 to 4 times for a new injury.
Great. I think ice is also a great painkiller, but for those folks who need something a little bit more than just applying ice, using some acetaminophen or ibuprofen according to the instructions on the box label or according to your doctor's instructions can be very helpful. So, what is a sprain and what's a strain? What's the difference?
So it's a common misconception, the difference between a sprain and a strain. The words are very similar, so it can be pretty confusing. Sprains are either pulls or tears in ligaments. Ligaments connect bones to bone, where a strain is a pull or a tear in a muscle or a tendon, where a tendon connects that muscle to a bone. The most that we see are usually sprains, that sort of thing, in joints. So ankles, knees, wrists, shoulders, that sort of thing in athletes.
I think all of our viewers have probably figured out by now that ice is an important home treatment for sprains and strains and other injuries. Tell us, if you would, how should everyone know that it's time to see the doctor, either emergently or going to the urgent care or waiting and seeing their doctor the next day?
Sure. So some warning signs that we worry about if you think that it's a sprain or a strain. A lot of times this can be kind of in the realm of fracture as well. So it's either stress fracture or an acute fracture. So warning signs for that typical injury would be something that's not healing the way that we would expect, more of a long-term, short-term after an injury. If you've rolled your ankle, you're unable to bear weight on that ankle, or you're having a lot of tenderness right over a bony area. Certainly if there's any open areas in the skin as well with tenderness, that would be a reason to come into the urgent care right away.
And here at the Palo Alto Medical Foundation Los Gatos Center, we have a big, brand new, beautiful urgent care center where we treat both pediatric patients with pediatric urgent care specialists and adults with our adult urgent care specialists. If someone has an injury that's not quite so serious, it is okay to wait until the next day and call for an appointment with a primary care doctor. What should our patients expect if they come to see the primary care doctor the next day or a couple of days later and they want to know how to help their injury heal?
So when we want to know we're seeing our primary care doctor and we're having an injury, it again depends if we think that we're more in your sprain or strain territory, and then your doctor is going to evaluate and make sure there's nothing else underlying, no need for an x-ray or anything like that. And then what they can go through with the patient is rehabilitation that we touched on a little bit before, over-the-counter anti-inflammatories, rest, ice, sometimes certain compression devices, especially for an ankle sprain, that sort of thing, but also home stretching, things to help prepare to not only heal the injury that's there, but to prevent further injury in the future as well.
Sounds like a lot of the things we do to get ourselves in shape before doing sports are some of the kinds of things we have to do if we've had an injury in order to get back to our sports.
Absolutely. And this is a lot of hesitation when I have patients that I want to send to physical therapy. Kind of what I underline to them is it not only helps to rehabilitate the injury that's already there, but for prevention of further injury as well, to help look at maybe muscle groups that aren't as strong, to help increase strength for those opposing muscle groups, to help prevent re-injury or further injury down the road.
I know that there are certain sports that put us at greater risk for certain kinds of injuries, sprains and strains and other things. Can you give us a little bit of an idea what certain sports might be more likely to cause certain kinds of injuries?
Sure. So certain sports we kind of see trends in injuries. So for things like hiking or running, we see a lot of ankle type injuries, sometimes knee as well. For more lateral movement, for our soccer players, our basketball players, we see ankle but also knee. And then for more of our contact sports, football, that sort of thing, we're going to start to see shoulders and knees more predominantly.
Well, I know that every high school coach, and at other schools too, has a major focus on keeping their players safe. And every parent wants to know that the coaches work hard to keep their players safe. Sometimes, though, we do have injuries, and we've talked a little bit about how to get those taken care of. But one of the most frightening injuries for families, or for individuals, is a concussion. So, I know that concussions happen when people don't wear their bike helmet, or even if they do have an injury with a bike helmet on, it might happen. But the big one we hear about is high school football. So would you tell me a little bit about what is a concussion and how do we try to prepare and prevent it?
Sure. So concussion has become a lot more of a hot button topic because we've actually acknowledged what we're looking at when we diagnose a concussion. So the initial blow of a concussion comes from the brain itself, from a striking force coming forward and backwards in the skull itself. So concussion alone is just that shearing force that happens with what we call a coup contra coup injury. We see it again in football players, sort of deceleration injuries, that sort of thing. So common symptoms of a concussion, sometimes we see memory loss right after. Sometimes we see loss of consciousness, but we don't necessarily have to see that. We can see dizziness, vertigo type symptoms, nausea, vomiting, and sometimes also irritability and sleep disturbances as well.
Great. So you've described a lot of symptoms, but if my kid's playing football and is down on the field at a high school football game, how does the coach know if it's okay for the kid to keep playing? And how does the coach know when they need to send them to the urgent care or the emergency room? What do they look for?
Right, so one of the most common places on the sidelines of the football field to determine is this a concussion or is it not, because the most important thing is not returning a child who's been concussed within the first 24 hours to a contact sport. So that decision has to be made right at the sideline. So luckily for us, they've made certain guidelines, certain questions, certain tools that even a college or a high school coach can ask and assess the patient right there at that time. So there's common tools that we have, one of the common tools being Maddox questions that we use right on the sideline. If the child's able to answer all these questions and go through an exam and it looks like this is not a concussion, that child can return to play. If there's any concern that this is a concussion, that child can not only not return to play, but also needs to undergo medical evaluation.
So some of these patients will come to our Palo Alto Medical Foundation urgent care, and some of them will end up in the emergency room. What should parents expect when their child comes to either the urgent care or the emergency room? What will the doctors do?
So when a child has a concussion and they show up either at urgent care or in the emergency room, the first thing that physician's going to do is a full neurological evaluation. What we want to make the distinction with concussion is this concussion alone, or concussion can occur with other more life-threatening things as well. So one of the distinctions that physician is going to make is does this child need imaging with something like a CT scan? Not every child with a concussion needs to have a CT scan, but certainly we don't want to miss children who do need to be evaluated. So there's certain warning signs and symptoms that we would look for, and there's also certain scales that we use for that as well on the evaluation, risk factors that let us know, does this child need a CT scan? Now, if the child does not, and this is diagnosed as a mild concussion, or there is a CT scan and that's negative, then that physician would have them follow up very closely with their primary care doctor to talk about return to play and to make sure all of the symptoms are resolving appropriately.
So when I was 8 years old, I fell off my bike. And when I was 8, I didn't have a bike helmet. All I remember is I woke up in bed at dinner time. My parents hadn't known where I was. For the rest of that night, my parents woke me up every 15 or 30 minutes to make sure that I hadn't died in my sleep. They were really worried. Is it really necessary that we don't let kids fall asleep after they've had a concussion?
So no, this is a common misconception. It's been a little bit sensationalized. Certainly it is something that a parent or a grandparent would say, you can't sleep the first 24 hours after a concussion. In fact, what you'll notice is probably your child is going to be sleeping more with a concussion. The things that we're worrying about are the things that we would be evaluating a child for to not let them sleep for hours to see, has there been a change? Has there been any new neurological deficit? Are they not acting themselves? Is there something different? But there's nothing harmful in sleep itself.
Tell me a little bit though, if I've taken my child to the urgent care or the emergency room, and thankfully we have a good assessment that there's no serious trouble, are there things I can watch for to make sure that nothing bad is happening that we've missed?
So the main warning signs that we'd worry about would be all of a sudden if there was progressive worsening of symptoms, worsening headache, all of a sudden there's repetitive vomiting when there wasn't before. Certainly a seizure can happen post-traumatically. That would be a reason to be reevaluated. If you're noticing any difference in pupil sizes, this is something we note as primary care in our sports physicals, is whether or not a child has a baseline pupil discrepancy. And the reason we do that is that way we can compare after a concussion. Is this new? Is this different? Has this been a change? So also decreasing level of consciousness. If you're going to wake Johnny up and Johnny's not waking up, and certainly not every 15 minutes like your mother did, but just in general checking on a child, they're not responding appropriately, that would be a reason to come back in.
Well, fortunately, both of us know that most concussions are mild, right? And most kids go home and they sleep through the night and they're feeling a little better the next day. But not every child who has a concussion, or every adult for that matter, is ready to go back to school or go back to work the next day. What should parents or individuals with concussions do in their life to recover from a concussion? You and I see folks like this all the time in our family practice. What advice do you give folks to help them feel better?
So absolutely right, Stuart. 80 to 90% of concussions resolve within the first 7 to 10 days. So most patients do well, even just on their own without any intervention. But there are things that we can do to help decrease this amount of time so that people can potentially get better faster. One of those is mental rest. I liken this for my patients the same way if you were to twist your ankle, right? And then you're walking on it all day. It's the same thing with your brain. So if you have a concussion and now you're on your computer, you're on your smartphone, you're having all of this auditory and visual stimulation, it's the same as walking on an injured ankle, which you probably wouldn't do. So that usually makes a lot more sense to patients, that they understand that they have to do what I call shut it down. So I explain to patients that we have to shut it down. That doesn't mean that you have to be in a dark room with no stimulation. But if you're reading a book, for instance, and all of a sudden we're starting to get either visual symptoms or headache, or our symptoms are coming back, then we do have to go back to square one. Anytime we're kind of doing this progressive return to things and we're getting symptoms once again, we have to go back to square one.
If you have a concussion and you're a kid, the good news is you might miss some school. The bad news is no video games, kids. All right. Well, as you said, most mild concussions resolve within 7 or 10 days. Sometimes they'll go a little bit longer, particularly with things like headache, a little memory loss, maybe some mild irritability, fatigue. Those are common symptoms. If things don't go away in 7 or 10 days, when do we start to worry? When should parents come back to see their primary care doctor? And how does the primary care doctor know that it's time to involve the help of a specialist, either a pediatric neurologist or a neurologist, both of whom we have here at PAMF in Los Gatos?
So very rarely, specialists have to be involved with care for concussion. A lot of times the distinction that we're making is this still truly concussion? If it's been 7 to 10 days and symptoms aren't resolving or they're new or concerning symptoms, we want to make sure that we're still dealing with the realm of concussion. The other concerning factors for a child that possibly was being reconcussed, so this is their second or third concussion, and it's happening at a much lower blow to the head, or symptoms are taking much longer to actually resolve, these would absolutely be reasons to have a specialist intervene at that point.
So I have a few more questions about sprains. As a parent or as an athlete, how should I know that it's time for my child or for me to go back to sports?
So it's very difficult to answer for children. It's more of a difficult answer for parents of when a child is ready to go back to be a participant fully in sports. Certainly we can talk about a little bit of incremental return, but I always tell my patients it's an investment in now. It's more difficult with younger patients because they don't want to be out of gymnastics. They don't want to be, missing their soccer game on the weekend that they know is coming out. So not to say that they're going to lie about their symptoms, but they might downplay how their symptoms actually are to their parents. And this is a little bit perilous because it would set them up for either a more severe injury or for the original injury to not necessarily heal the way that it originally would. So individualizing return to play for every child, it helps a lot now, especially for children who are in varsity teams. There sometimes is, the coach that's involved as well, looking for signs or symptoms on the field to make sure that the child really is performing where they normally were. Because we can't 100% always rely on the student athlete to be, telling us if something isn't going right. And then incremental return. So, if we're going back and we're doing soccer, for example, and we're running sprints and it's provoking symptoms, this is too soon. So we want to make sure that, we're not putting them back in as their first return after a sprained ankle in a full game. So a lot of times coaches work with parents and certainly with the student athlete to decide what that time frame is.
So I hear you telling me that it's a team approach to deciding when kids get to go back to their sports teams. Parents, the kid, coaches, trainers, and their primary care doctor. With some more serious injuries, we do see kids who have fractures. And a lot of parents worry that fractures in a child might affect their growth. What's that all about?
So children's bones aren't formed in the way that an adult's are formed. It's not final in its form. So where we look at children, we know that they're going to grow. This comes from their bones. So at the ends of bones, this is typically where a fracture could occur, there's something called a growth plate. This is what allows bones to continue to grow. Once we're done growing, the growth plate has fused, and then as an adult, we're not going to continue to grow. We don't have this chance of injuring the growth plate. But for children, it can be a very serious injury, and the concern with that would be for a bone to not fully grow or to not grow in an appropriate manner. That's why for most growth plate injuries, if there is a fracture, we'll have a specialist intervene, like an orthopedic doctor or a bone specialist. That way it can be followed very closely, and that way they're watching for certain healing aspects in that growth plate to make sure that this injury heals appropriately and growth is not affected.
So one thing I like about being a doctor taking care of kids who have sports injuries here in Los Gatos is the Palo Alto Medical Foundation has a number of orthopedic specialists. We have a podiatrist who takes care of feet and ankles, and we also have a pediatric orthopedic specialist. So along with our primary care doctors, we have a whole team of folks who can help out for your injuries. So today on Health Connections, we've talked about the importance of being safe, preparing for sports, stretching, hydrating, and all of those other things that can prevent injuries. We've talked about common injuries and how we treat them both at home and in the urgent care or the doctor's office. At the Palo Alto Medical Foundation, our most sincere hope is that you and your family will always be active, happy, and healthy. Thank you for joining us today on Health Connections on KCAT TV, Los Gatos Monte Sereno Television. See you next time.